The miscellaneous metallic poisons include the arsenic, the antimony, and the thallium that is commonly being used as a of different medico-legal importances. That also includes the homicidal intent, that includes the suicidal intent, as well as it can be of the accidental origin. So arsenic poisoning, basically it includes the acute arsenical poisoning as well as the chronic arsenical poisoning. And the chronic arsenical poisoning is characterized by the raindrop pigmentation that is quite common. Working as a forensic practitioner, you will come across a lot of cases in which these chronic arsenical poisoning are quite characteristic, and they have their own external features, as well as if we take the blood samples and they are sent to the histopathologist, the tissue samples are taken and they're sent to the histopathologist, we'll find this arsenic poisoning even in cases of the acute or it can be of a chronic kind. So all of this is discussed over here in this section. And moreover, we'll be discussing the antimony as well as the thallium. These are also being commonly misused, and that is all discussed over here in this section. Talking about the metallic poisons, it is basically environmental poisoning is quite common when we talk about these metallic poisons, and especially the arsenical poisoning. It can be of an acute origin or it can be of a chronic origin, as well as occupational poisoning is one of the factors that is commonly being observed. We basically divide, when we talk about the metallic poisons, we divide them into the chronic as well as of the acute type. So the suicidal, accidental, and the homicidal intents are all discussed over here in this section. Now, arsenic has its own effects on the human body. It is a constituent of the normal animal tissues. So it is poisonous in compound forms. So if it is in a compound form, it is more poisonous rather than in a separate isolated form. The cellular respiration interference is one of the factors that is observed in cases of the arsenical poisoning. So it is kind of a asphyxiating condition when we talk about the arsenic poisoning. Target in the vascular endothelium. So the vascular endotheliums or the endotheliums of the vascular structures, for example, it can be arteries, it can be venules, as well as it can be the capillaries. All of these are affected in cases of the arsenic poisoning. The lesions due to the increased permeability are again one of the causes to it, and the tissue edema and hemorrhage are one of the complications when we talk about these arsenic poisoning. So the fatal dosages in the arsenic poisoning basically are quite variant. It can be of a acute type as well as it can be of a chronic type. 150 milligrams has proved to be fatal on empty stomach. So this is basically the fatal dose, and the fatal dose is basically the dose of any poison that basically can cause death of the person. So 250 to 300 milligrams is the minimum lethal dose that is observed and that has been recorded. Now the large dosages are mostly vomited out. So it's basically a natural process. They are vomited out, and there is rapid death in cases of this kind of arsenic poisoning. Shock is one of the complications being observed in these cases of the arsenic poisoning. As you can see over here, this is the raindrop pigmentation that I was talking about over here. So it is one of the complications being observed over here. And then we have the cardiorespiratory failure. That is one of the complications over here when we are talking about it. And the hepatorenal failure is also one of the complications that is being observed over here in these cases of the arsenical poisoning. Basically, the asphyxiating condition and also the organs of the metabolism are involved in these cases of arsenical poisoning. The autopsy findings in cases of the acute poisoning, they include the minimal findings. It can be any rash, or it can be any arsenical rash or any mucosal rash or the raindrop pigmentation. These can be the minimal findings that are found on the autopsy. And the reddening of the gastric mucosa is also sometimes quite evident in cases of these arsenical poisoning. Now, if we look at the rugae of the stomach, they are of the red velvet appearance over here, somewhat of a dark appearance over here in cases of arsenical poisoning. Now, you have to basically categorize the sign and symptoms into different categories. We have also observed this darkish discoloration in cases of cyanide poisoning. So, if we observe a rugae which is quite red, so these two poisons can be suspected. It can be an arsenical poisoning or it can be a case of cyanide poisoning as well. But of course, the smells and the other characteristics are different in cases of the cyanide poisoning. The intestines are usually normal in appearance if we look at them, and the subendocardial hemorrhages are also one of the causes of the cyanide poisoning over here. Now, the hypotension is also quite evident over here. In cases of hypotension, we have basically a shock-like syndrome, and basically a lot of IV fluids are required. If we want the patient to recover from this stage, we'll administer the double bore cannulas and administer the IV fluids accordingly. The loss of the blood volume and the blood pressure is again quite evident, and that is also going to result in cases of shock. So the neurogenic shock is another way. One of the ways is through the loss of the blood volume and the hypotension, and one of the ways is through the neurogenic kind. So these are all observed over here, and the blood-filled blisters is one of the complications that is observed in cases of the metallic poisoning. Now, the chronic arsenical poisoning, as we were discussing, this is the peculiar raindrop pigmentation that is observed in these cases. The diagnosis is extremely difficult in these cases and is sometimes misdiagnosed as the gastroenteritis. So the usual symptoms, the patient will complain of nausea, vomiting, diarrhea, and thus it is going to be confused with the gastroenteritis. Now, the dehydration from the diarrhea is another symptom that is quite common, and it retards the usual moist putrefaction. So that is going to basically highlight these cases of arsenical poisoning. And then we'll have a dry, scaly, hyperkeratotic skin. These are the surface conditions of the skin, even on the hands, on the palms, and even on the soles of such person. The raindrop punctate pigmentation, this is the terminology that is being used in these cases. There is a raindrop pigmentation that is observed in these cases. And liver necrosis is another complication that is being observed in such cases. Now, the chronic arsenical poisoning, we'll observe edema of the face and hair loss. There will be hemorrhagic gastritis. Small intestine is mostly dilated or red in color. Non-specific congestive edema is observed in such cases. The large intestine will observe minimal changes over here, and sometimes it can appear normal in a lot of cases. And then another complication that is observed in these cases is the liver necrosis. Now, what are the samples that are sent to the chemical pathologist? It's basically in acute poisoning, we'll be sending the stomach contents. The small intestine is tied off at each end, and we'll cut the portion and send it to the histopathologist. And then the blood, urine, and the liver samples that are also being routinely sent in all of the autopsies that are also being sent in this autopsy. The ranges in the blood are 0.6 to 0.93 milligrams per liter, and in the liver it is 2 to 120, that the average is almost 29, and in the kidneys it's almost 0.2 to 70 milligrams per kilogram, and the spleen it's almost 0.5 to 62 milligrams per kilogram. Talking about the brain, we'll have 0.2 to 4 milligrams per kilogram, and normal average ranges are almost 3.3 in the blood, 29 in the liver, 15 in the kidney, and 8.8 in the spleen, and 1.7 in the brain. So the chronic poisoning is basically categorized by the blood from the peripheral veins, and it then enters the stomach and the contents, and the small intestine and the contents are also highlighted over here. The samples of the large bowel contents are also taken, and they are sent to the histopathologist. The urine and the bile is also sent to the chemical pathologist for further assays, and the final test or the final toxicological samples and the results are being shown on the autopsy report as well. Then we'll send the histological samples of the liver and the kidney to the histopathologist for further assays. The nail clippings and the whole nails are sent, as well as the hair samples. Talking about the antimony, it's basically a vehicle of poison, is starter emetic. It is usually suicidal and homicidal as well. Pathology and toxicology, it is similar to arsenic in these cases, and the fatal dose in adults is about 1 gram. Talking about the thallium poison, it's basically multiple poisonings are observed in such cases. It is deposited in the liver mostly, and X-rays should be taken before autopsy in such cases. Autopsy appearance is quite significant when we are talking about the thallium poisoning and the variable and non-specific kind of poisoning. It's basically when you observe the autopsy in such cases of thallium poisoning, there is no specific sign and symptom in these cases, and so it is quite a confusing poisoning case. The person usually appears pale and the degenerated myocardium is observed in such cases. Hair loss is quite evident in cases of thallium poisoning. Especially the lateral 2/3 of the eyebrows are the regions that are affected in cases of thallium poisonings. So, liver and renal tubular necrosis, and it is discussed later on what is basically this is basically the due to the effect that thallium is metabolized in the liver and the renal tubules. So, they are going to be affected in these cases. So in this section, basically, we dealt with the metallic poisoning, especially the arsenic, the thallium, and the antimony is discussed over here in detail. That is the end to this section. Thank you for watching sqadia.com.